So I was really fortunate to be the discussant for Dr. Jagannath and his team's abstract about one of the new bispecifics in myeloma. It's one of the ones made by Regeneron. I'm not very good at pronouncing it, so I'm going to call it Linvo. Essentially, it's a study of over 100 patients where they've treated the patients with this bispecific, which is a BCMA and CD3 bispecific, in the relapsed refractory setting. So the majority of the patients had triple-class refractory disease. And we would expect that group of patients to maybe have a progression-free survival of somewhere around 4 months and an overall survival of somewhere around a year. And this study actually showed that their probability of being alive at a year was over 68%. So an amazing improvement in progression-free survival and a response rate of about 70%. So excellent response rates. I think one of the great things about the study, though, was that it not only included patients that I regularly see in my clinic, so there was a lot of patients over the age of 75. There was also a diverse group of patients, so Asians and African Americans. But in addition to that, because the drug is given as an intravenous infusion, the cytokine release syndrome was very low grade, so grade 1 and grade 2, but also incredibly predictable. So it occurred in an early time frame, which meant that patients only had to stay in hospital for the day 1 dose and the week 2 dose. After that, patients were able to receive the drug as an outpatient. The other great thing about the study was that the frequency of infusions dropped. And so it went from a weekly infusion to every 2 weeks and then to every month. And importantly, when patients reached the monthly mark on the infusions, the infection rate dramatically fell. So I think it's a great drug, has a really good side effect profile, and is going to make a big difference for patients.